Vice President over the clinical experience at MedSeek. I guess a quick informal poll for the group. Who in the past week has done a banking transaction, bought a ticket for an airline, and or purchased something online? We've been taught by other industries how to interact with all of the other areas in finance and banking, and that's where we're really woefully behind in healthcare. So we've got expectations from patients and providers of how they should be interacting with the healthcare organization. Specifically, there was an individual that stood up yesterday, talked about their son who's a physician that played Nintendo growing up. And those are the expectations that they have. I think that when we've looked at that from an expectation standpoint, that's what MedSeek is really focused on for the past 15 years. We work with over 800 hospitals in North America, so just solely focused on creating what we would call a virtual front door to the hospital in order to drive revenue to the key service lines that those hospitals are looking at from a physician and or a patient standpoint. I'm going to shock some individuals in the room right now and say that I'm kind of second guessing my strategy after hearing John mention that there's $580 million in the market for HIE. MedSeek is not interested in being an HIE company. That's the truth. If I'm a hospital CIO, I have a million options on how to move data from point A to point B. And it is interesting. I had a chance to speak with John at HIMSS this year. How many vendors raise their hand now that there's all that money in the marketplace to say, yeah, we can move data? Okay, it's not that difficult. This is not a technology issue. I think where MedSeek's focused, and I think the perspective we want to bring to the table, is really to start to talk about where do we start to look at health value exchange? How do we start to bring value to the patients and the providers? And something I've been very encouraged by, I think Dana Moore from Centura Health mentioned this yesterday, we need to be focused on the patient. I haven't heard a lot about CCD, I haven't heard a whole lot about HL7, and I applaud everyone in the room for keeping that out of our discussion and really focusing on patient care, because that's why we're here. So I think our perspective is looking at these HIEs and the barriers to success and sustainability is bringing in the patient and focusing on how do we improve their care. I had an opportunity to hear from Dr. Danny Sands, who actually works for Cisco, I believe. He talked about a transformation in healthcare where in the old days we had me doctor, I have all the power, patient just goes along with whatever the doctor says. We're seeing a changing of the guard. I think we see symmetrical healthcare. The physician is a consultant to that patient's healthcare. That patient is informed of what's happening for them. And again, why is that? We've been taught by every other industry how to interact with the healthcare organization. As healthcare providers, we've got to step up to the plate and start to interact with our constituents in a manner in which they expect.
I think with the new release of the meaningful use criteria, I think that you're going to see a lot of hospitals really struggle considering what their existing priorities are to really meet meaningful use. If you start to look at the criteria, there's really about a 24-month window for those hospitals and healthcare organizations out there to meet meaningful use. So a lot of their initiatives, if they haven't already started down that path or have a plan to meet meaningful use criteria, are really going to struggle to meet it. So I think they're going to be scrambling to select vendor partners or to go to their existing vendors to figure out, how can we start to engage patients and families? How do we start to improve care coordination? I think that's one of the biggest areas that we're going to see now that I guess the final criteria has been set. I think that you're going to see organizations that are looking, really of just checking the box. At the end of the day, what's going to happen is they're going to be left feeling a little empty as it relates to what meaningful use really did for them. If you start to look at the end in mind and work backwards, a lot of the healthcare organizations that have really planned for 2015 and beyond, that start looking at engaging patients' family in a manner that patients are expecting it, the way that we bank online, the way that we travel online. If they're setting that expectation with what they're meeting meaningful use with today, I think that what they'll find is that it's not just meaningful use, that it will be used meaningfully. And I think that's the key that we've got to look at healthcare. Otherwise, it's just kind of wasteful spending. I think when you look at health information exchanges in the past, this is not a new topic. It's not a new initiative. It's been around since the early 90s when we had CHINs and then RIOs. Ultimately, we can call it whatever we want to and pump a lot of dollars into the marketplace. I think the first thing you have to look at from a health information exchange, either be it at a regional or community level to the state, is you have to establish trust. When I go to hospital CEOs and say, hey, Mr. and Mrs. CEO, we want you to dump all of your data into a large repository for sharing of information across a community, they're not so warm to that idea. So in order to establish trust, you've got to get a technology platform in place that those individuals feel protected of what they're sharing. That's where with MedSeek we've looked at more of a federation of data, where we keep data within the source of truth and look at more of a federated model initially, with the ability to grow into more hybrid approaches where you're storing information for the utilization long term, and the ability to do quality reporting, analytics, et cetera. I think that's the first challenge. Secondly, I think the next challenge you're going to see with the RIOs and the HIEs that are out there in the marketplace is a business model. How do we make this sustainable? Very much like the, kind of the home mortgage bubble that's been burst recently. You're going to have a lot of money out there to get something to stand up, but how are you going to keep that sustainable long term? How are we going to pay the mortgage on this? And if we don't create a sustainable model or a sustainable solution that engages patients and their families, and is utilized and improves the workflow for physicians, again, I think we're spending money in a haphazard manner.
I think from MedSeek's perspective, if you start to look at this, the reason that the vendor community is probably 70% focused on private HIEs is because it takes so much difficulty in getting 16 to 20 hospital CIOs and CEOs together in a room to say, what are we going to share? We all compete. So I think the number one challenge, barrier to success of an HIE is trust. I think if you look at a lot of the market research, they start to look at the specific data models that will facilitate trust. So I've seen a lot of the HIEs that we've participated in, that you look out in the marketplace that John obviously referenced, you would start with a federation of data. We're not going to store any information from the individual sites. We'll just go from a federation, and then we'll migrate to more of a hybrid model so we can do more around analytics and quality reporting. I would say that would probably be the first challenge. Secondly is just the business model. So, if you look at a private HIE, it makes perfect sense. Why would I do this? I'm driving referrals to, my cardiology service lines, pulmonologists, and a specialist. If I start to look at sharing data across multiple facilities, unless you're focused on the patient, there isn't a business model to look at right now. So I think you see a lot of those hospitals looking more of almost to the point of a large HIE that's bringing in multiple entities, looking at themselves somewhat as like a GPO. We're providing a service to these individual member hospitals that are participating. We're giving you the ability, instead of you having a line item on your budget for data exchange, the HIE provides that service. So I think we're going to see a migration of some of those challenges from a business model standpoint. I think that's where they're really focused right now.
I think Sarah Baker, sorry, take a moment. I think Sarah Baker is a perfect example of a patient that in healthcare, if we really think about who our customer is, from a vendor standpoint or from the healthcare organization, it really comes down to a patient making a decision at the moment of truth about where do I get healthcare services, what physician am I going to interact with, and as we look at the expectations that an individual like Sarah Baker has, she banks online, she travels online, that's the expectation she has. So when I look at Sarah Baker, to me, that's an individual in my community and your community that's looking to find healthcare information. I think for MedSeek's purposes, what we looked at is for the past 15 years, we've focused solely on improving the physician and patient experience with healthcare. There are great systems out there that do EMRs and EHRs, et cetera, PACS systems. Those are in place for a reason, but we never really consider how the individual is interacting with the data and how the individual patient is interacting with the data. So when I look at Sarah Baker, it's really been a persona that MedSeek's created to say, as you look at what we've accomplished with over 800 hospitals in North America, we've tried to create a persona here with Sarah Baker that shows this is how she's interacting with the health system, how she finds out about a medical center via Google when she goes into the search engines and says, I want to find out about maternity services because I'm a 32-year-old female, I'm having twins, and I know I'm a type 1 diabetic, to requesting an appointment with a provider to be able to review her lab results, even to the point of service to say, hey Sarah, do you want to find out how much it's going to cost for you to have your babies here? at this specific medical center. So it's really changed, I think, a lot of the marketplace perception of what the true experience needs to be for patients, because you're setting something out there to say, this is what Sarah wants to interact with, and this is how she's working every day. Well, I think over the next 5 years in just healthcare technology overall, I think we're going to see a larger drive towards consumerism. Just as we've seen it in the pharmaceutical arena, where folks are asking for the purple pill, you're going to have patients who are engaging with their physicians in a manner that they require it. I think they're going to have more of a symmetrical relationship with their provider. We have all of this information out there on the web where patients are asking for information. So I think one of the biggest trends is that patients will become more empowered in their own individual health care. I think some of the meaningful use requirements around engaging patients and families certainly advocates for that. I think the other big challenge that we're going to see, or probably a big trend that we're going to see in healthcare technology in the next 5 years, is the whole movement towards quality of information and accountable care organizations. We're actually going to incentivize physicians and providers for providing good health care and for collaborating and cooperating. There will be challenges around that, around systems connectivity. That's where MedSeek sees a fit in the marketplace for what we're able to provide, and being able to integrate to multiple systems to provide an end-user experience, to find out what's happening for Brad Hawkins in his ambulatory EMR as well as at the hospital. I think, the biggest challenge we've seen with healthcare executives when they look at the arena of e-health is they consider it the internet or the web. Much like Delta.com has changed the way the virtual is the front door to Delta Airlines, we need to consider the website and the way that patients interact with your healthcare organization as the virtual front door to your hospital. So if I'm a healthcare executive today, I have a strategic plan around patient safety, and we want to be committed to healthy communities, etc. I've got to consider, what's my plan to interact with individuals on the web? How am I attracting the right physicians? How am I getting their mind share and market share in my community? I think that if they have a plan to achieve that, then they're much better off. A wise person we know says hope is not a strategy. So hoping that physicians will refer to my hospital, hoping that patients will come into the front door is not a strategy for the hospital. So I think the number one advice that I would give to a hospital executive is, what is your plan for e-health? What's your roadmap to success? It's really easy to say we've got strategy, but what are the really tactical steps that we're going to get there over the next 5 years?